Passengers of the hantavirus-stricken MV Hondius are returning to Britain. So what next for them, and how will officials here ensure the virus doesn't spread? Passengers and ship crew not displaying symptoms on arrival were brought to shore by small boats before being bussed with UK government staff to Tenerife's main airport and then boarding a chartered repatriation flight to Manchester. The World Health Organization says the risk to the public is very low because asymptomatic transmission's unlikely. It's hard for the virus to be passed on if you're not showing any symptoms. Passengers, crew and medical teams must wear PPE, including face masks, during the journey from Tenerife and upon arrival in the UK. Once here, passengers are safely escorted to an isolation facility at Arrowe Park Hospital on the Wirral, where they'll undergo precautionary testing and assessment for the virus. The accommodation's separate from the main part of the hospital. In 2020, the same facility housed British nationals repatriated from China at the start of the COVID pandemic. This time, people will stay here for 3 days as public health experts determine whether they can self-isolate at home. Once home, they'll be asked to stay in isolation for 45 days. They'll be in constant and daily contact with UK HSA medics who'll monitor their condition, asking them to take their temperature and checking for symptoms too.
It may well actually ultimately turn out to have not been necessary, but we won't. But it's rather better to make that assume it's necessary than learn in 8 weeks' time that maybe you should have actually implemented these sorts of control measures.
It's not the only effort by British officials to contain hantavirus. A British national who left the Hondius on the 13th of April after developing symptoms is being treated on the tiny Atlantic island of Tristan da Cunha, where he lives. A specialist team from the British Army parachuted onto the remote island, which has no airstrip, to provide medical support. There is still much that isn't known about this virus, so plans for the passengers will be kept under review. But health officials say, unlike COVID, this isn't a virus that spreads easily and the risk to the general public remains low.